I'll use one just so I'm not yelling. I'm Katie Hall. I'm the Public Information Officer for OWASA. I want to welcome you to our third PFAS Community Chat. I see some familiar faces. Thanks to all of you who are coming to this for the first time. Thanks to all of you who are coming to learn more. Our experts here with us tonight are here to ensure that accurate information gets to our community and to give you all a chance to ask questions from people who will make sure you get correct information. Our first PFAS Community Chat was about paying for PFAS, so how we're gonna pay for drinking water treatment for PFAS, and our second was about the science and engineering behind removing PFAS from drinking water. And both of those events can be seen on our YouTube channel in their entirety from our very high-tech video setup that we have here, and that is held up with a box of big pens. You can also visit our hub of information about PFAS at owasa.org/PFAS in your water, where we have all of our monitoring data going back to 2018, as well as links for you to get information about everything from public health to what you can do right now at home to reduce your exposure to PFAS. We're very fortunate to have our panelists who are here with us this evening. To my left is Dr. Detlef Knappe, the S. James Ellen Distinguished Professor in the Department of Civil, Construction, and Environmental Engineering at North Carolina State University. Dr. Heather Stapleton, the Roni Rochelle Garcia Johnson Distinguished Professor in the Nicholas School of the Environment at Duke University, and Mr. Kennedy Holt, an environmental toxicologist in the Occupational and Environmental Epidemiology branch of the North Carolina Department of Health and Human Services. So thank you so much to our panelists for being with us this evening. The format of our community chats is a moderated discussion among our panelists with ample interaction with all of you. And as I move through the questions with our panelists, I will give you all a chance to ask questions. I just ask that your questions are related to the topic, since that is what our panelists' expertise are here this evening. And so, Dr. Knappe, I'd like to start with you. In April this year, the EPA set what they call maximum contaminant levels, or MCLs, for 6 PFAS compounds. What's significant about the levels that the EPA chose for drinking water regulations, and why those exact levels?
In terms of the levels, EPA, well, first of all, I think it's significant that EPA set a nationally enforceable drinking water standard for PFAS in the first place. Having a national standard protects communities all around the country, including in states like North Carolina, where we don't set our own drinking water standards. We really only defer to the national standards. So nationally, that means around 100 million people that are currently exposed to elevated levels of PFAS will be protected by this new drinking water standard. And so in terms of PFAS, there's thousands of PFAS out there. The EPA regulated in total 6, and for 5 they issued a maximum contaminant level. So 5 of the 5, 2 are pretty well known. You may have heard of them, PFOA and PFOS. So PFOA is perfluorooctanoic acid. It's the topic of the movie Dark Waters, if you've watched that. It's a compound that's used to make Teflon, or used to at least. And the other is PFOS, perfluorooctane sulfonic acid, which was an important ingredient in firefighting foams. And EPA considers both PFOA and PFOS likely human carcinogens, and so consistent with EPA policy, EPA set a maximum contaminant level goal of 0 for those 2 compounds. But you can't have an enforceable standard of 0 because you can't prove 0. So the standard was set at 4 nanograms per liter for those 2 compounds because that's the lowest level that commercial labs can accurately measure. So in addition to those 2 compounds, EPA is regulating 3 additional ones with individual MCLs, maximum contaminant levels, perfluorohexane sulfonic acid, which is also an important component of firefighting foam, perfluorononanoic acid, which is a compound similar to PFOA. It's also used to make fluoropolymers. And then Gen X, or hexafluoropropylene oxide dimer acid, it's a mouthful, which is the replacement for PFOA. Right? So if you go out and buy a Teflon pan, it might say no more PFOA in the production, but that means the pan was made with Gen X, which is another harmful PFAS. So for each of those three, EPA set the standard at 10 nanograms per liter, and that's to help us be protected against toxic effects to the liver, to the thyroid, and to developmental effects. The final thing that's really remarkable about this standard is that it recognizes that we're exposed to PFAS mixtures and the additive toxicity that's associated with being exposed to PFAS mixtures. So there's another compliance point that drinking water utilities have to meet, and that's that the sum of 4 PFAS, PFNA, perfluoronanoic acid, perfluorohexanoic acid, perfluorohexane sulfonic acid. I usually just use these acronyms, but then it's like alphabet soup. So there's 4. Perfluorohexane sulfonic acid, perfluoronanoic acid, Gen X, and perfluorobutane sulfonic acid. Those 4 also have to be as a group at a sum concentration so that there is something called a hazard index stays below 1. So that means, that recognizes that we're exposed to a mixture of these compounds, and the drinking water cannot exceed some combination of those 4 compounds so that the mixture becomes harmful. So that's the goal of the hazard index. And so it's a kind of a framework that's a little bit more complicated than 1 compound, 1 number, right? So it's maybe a little bit more difficult also for water utility to communicate that concept, but it's really just an extra component of this drinking water standard to recognize that we're really exposed to mixtures of PFAS.
Thank you. Does anybody have a specific question about those limits before we move on? Okay. Thank you.
Sure.
Dr. Stapleton, your lab is working on.
Okay. Oh.
Yes, sir.
Sorry, these are new proposals that are under consideration at this point?
So these standards are in effect right now. And they're also under legal challenge, so things may still change in the future, but these are the currently promulgated standards. So they're part of the Federal Register, and drinking water providers right now are going with that as there's a timeline that utilities have to meet, and so currently everybody's proceeding with meeting that timeline.
And is there a projection on the timeline for when when the mitigation of what's currently in our ground, other places that would have an effect, or is it just stop doing what we were doing before?
So these standards are specifically for drinking water providers to deliver drinking water that has PFAS levels below those maximum contaminant levels. So it more indirectly affects remediation. So an important additional aspect of having national enforceable drinking water standards is that now you can also start building wastewater discharge permits around those standards. So that's another battle, but now there is a framework in place where source waters can also be better protected.
Thank you. Kim?
I have kind of a 2-part question. So recognizing that there are over 10,000 PFAS and counting, I believe, and the EPA has now taken steps to regulate 6. My first part of the question is, do you think the steps that utilities will be taking to filter those 6 out of the drinking water will effectively treat a good portion of the other 10,000. And my second part of the question is recognizing, as you articulated, just the interconnection of many different PFAS that are in the environment, and looking at the action level and part of the regulation. Do you think EPA will start moving towards regulating other PFAS and also looking at the possible combinations and effects of intermingling PFAS?
So the first part of the question, if there's treatment in place to remove the regulated PFAS, will that protect us against the unregulated PFAS? And I would say in large part, yes. There are many PFAS that are, I would say, similar in structure and well, their chemical behavior is such that they would also be removed by absorbents like granular activated carbon, which is a common technology to remove PFAS from water. So there will be some that there are some PFAS that would pass through these activated carbon filters or would get removed for a short amount of time before they start breaking through. So those are sometimes called short chain or ultra short chain PFAS. So that's something that we're still learning about. What's the toxicity of those short chain and ultra short chain PFAS? But for the majority of PFAS, I would expect that the technologies that will be installed for their removal would capture also many others. It's a little bit hard to look into the crystal ball of what will EPA do next, but I think one of the goals of the hazard index was to have a framework in place that allows them to add additional compounds to the hazard index as we learn more about the toxicity of individual PFAS so that the mixture is such that it's still safe to drink the water.
Thank you. Any other questions about the case permits? Okay, back to you, Dr. Stapleton. Your lab is working on various projects in North Carolina to test PFAS levels in your study participants' blood. Can you talk a little bit about why PFAS levels in blood are important to study and what those results mean for us?
Certainly. So the best way for anyone to understand what their health risks are to have their blood measured for PFAS. In 2022, the National Academy of Science, Engineering, and Math convened a group of experts on PFAS.
Could you speak up a little bit?
Oh, sure. In 2022, the National Academies of Science, Engineering, and Math convened a group of experts related to PFAS, health concerns, epidemiologists, doctors, things like that, to review the state of the science on this topic. And they have a report out that's publicly available with their suggestions for clinical follow-up pending your measurement in a blood test. And you can go online to view this. I'm sure we could provide resources for this. Basically, it's based on getting your blood measured, particularly for a certain 7 PFAS, but measured PFOA, PFOS, and a few others, where we know more about the health effects for those 7. Really what this guidance suggests is if you have levels above 20 nanograms per mil, that you should be talking to your doctor about getting checked for certain things, which include high cholesterol, thyroid disease, and I believe it was kidney cancer. And for women, just getting screened for breast cancer as recommended. To understand your health risks, you really have to understand what's in your blood. And because if you have PFAS in your water and it's elevated, there are models that can help predict what that likely means for levels in your blood, but that doesn't guarantee that your blood is going to be elevated because there's other factors that can mediate that exposure pathway, such as if you have a point-of-use filter in your home, right? So it might be in your tap water, but if you are taking your drinking water primarily from your refrigerator, right? So some of us have a spigot on a refrigerator. Well, there's a filter in there which has activated carbon typically, so that could be removing PFAS in your water. So it may not be elevated in your blood relative to what you'd predict based on the drinking water. In contrast, it's always possible that it could be low in your drinking water, but you could still have higher levels in your blood because there's another source in your home. In general, drinking water is a significant and known pathway for exposure to PFAS, but it's not the only exposure pathway. We do know that unfortunately sometimes there are members of the food supply that have some low levels of PFAS that can lead to exposure. Food packaging, some types of food packaging can lead to exposure. But unfortunately, there's other, even things like some of our building materials have PFAS treatments on them, and we're just learning about some of these treatments now. We do know that PFAS are present in indoor air and particles and dust in our home, and we're still trying to understand the relative importance of these pathways. So the best way to understand your health risk is always to get your blood measured if possible, but it's hard. Not everyone has access to those resources, but there are companies that are now offering home testing kits. There's a cost associated with them, unfortunately, but there are a few of these that you can request a kit, be sent to your home with a finger prick stick, you mail it back, and they will provide results, particularly for those 7 more hazardous PFAS. So that is available.
Thank you so much. Does anybody have questions about that? Yes.
I have a question either for Dr. Stapleton or perhaps Kennedy, just about what your understanding is of the level of awareness of doctors. I mean, if someone goes to the doctor and is diagnosed with a condition that could be linked to PFAS, how likely are they to suggest a blood test to see if you do have elevated levels of PFAS and could therefore take steps to reduce your exposure? Or, I mean, what is your understanding of kind of the level of education of
Sure.
doctors?
Well, I'll mention them and you can follow up too. I know this has been a topic of conversation, at least at Duke, with our medical center. So we have developed resources for a lot of our GPs and our cancer center medical staff to try to update them and make them more aware of these issues, so that they know that, particularly trying to identify some of the regions where we know drinking water is contaminated with PFAS. If they have a patient that comes in from that area and they have some symptoms of the disease, they might want to consider having that patient's blood tested for PFAS. And actually at Duke, any doctor can actually draw up a request for a blood test for PFAS. There is an ICD code for that, I believe it's called. Now there's always questions about whether insurance covers that or not. That's a different issue that I don't know all the details on, but doctors can request that. But I think what I'm finding at least is that not all the doctors and medical physicians are aware of this issue. There's been some challenges in trying to provide access to that information to medical physicians. DHHS here in North Carolina has been sending out resources to physicians as well, but I'm not sure it has reached everyone yet.
Yeah, I'll just add one last thing. So in terms of what DHHS is doing, so Heather mentioned the National Academies work that had been done. So when that work came out, DHHS took that, I think it was 400 or 500 page document, and we synthesized it down to 3 pages to provide kind of the greatest hits of that for doctors. And we worked on that and developed that and sent that out to physician groups across the state to help raise awareness. We do know, as Heather said, not every physician received it or necessarily got that information, but we are still working to push that information out. It is publicly available on our website, so it's not just for physicians. And when I talk with people that have concerns about their PFAS exposures, and I mentioned some of the same stuff that Heather mentioned, but I also send them to this document, and I'm like, take this to your physician, because your physician may not know about this. And we also have other links and other information going to where to get your blood tested, what PFAS can be tested for, because there have been groups out of Michigan State and other universities that have done a lot of work to identify labs that can identify PFAS and measure it in blood, and have compiled a lot of this information together. So we provide those links as well, because again, you can, if we don't want people going to the doctor and just be like, I want to get tested, and this kind of goes blindly. So we kind of provide that information so that doctors are trying to find what is credible and what is out there. We try to provide that in that document as well, so that there's at least some guidance there that they can base it on, and it sees that it's peer-reviewed publications as well. So we're trying to provide good information to physicians so they can better help and assist their patients.
What's that website?
I can send, if we talk afterwards, I can get you to our website and I can show you where it is.
The other thing is, if you just remember the term PFAS exchange, if you Google that, and I think you can Google that, or put it in any search engine on an internet site, it should be the top one that comes up, PFAS exchange. Lots of great resources to the information that we just mentioned. They also have a really nice tab on there. It says, what's my exposure? And if you click on that, if you have had your blood or your water tested, you could actually enter your results and it puts it in context for you. It tells you where you fall compared to the general public in terms of your percentile for either your blood or your drinking water. So it's a really great resource.
So I was at the Pittsburgh presentation that y'all did a few weeks ago. And so I know you've done the blood testing in the community. And what I heard you say was that the levels of PFAS are going down. And I understand that there's no causal, you can't attribute a causal explanation for that. But you did say, or somebody said, that at least some of it has to do with people changing their lifestyles. So I went home and went through all of my plastics. And I have Tupperware that I got when I moved out of my mother's house 50 years ago. It's gone now. But what are the other things in the house besides just the plastics that can be replaced? Is there a good way to find those?
Well, just going back to your Pittsburgh question, please correct me if I'm wrong, Detlef, but my understanding is a major reason why the levels do appear to be decreasing is because they were able to stop a majority of the PFAS from entering the Holt River.
From the
And
filtration.
being in the drinking water. There's the filtration, but there was some emphasis on the source. So they were able to stop a lot of it, not all of it, from getting into the Holt in the first place. And then there was the improvements to the drinking water facility that also helped remove some of it. That made a big difference, I would say, in terms of why the levels do appear to be dropping in the blood of the Pittsburgh residents, for sure. It becomes more challenging in terms of trying to identify other exposure sources, as I said, because some regions we know that unfortunately there's been produce or dairy products that have had low levels of PFAS in there because there's been some contamination in those regions. There's some regions of the US where some of the milk has been contaminated, there's cattle. Some areas where we've seen higher levels of home-produced eggs for some reason. Produce grown in areas where the water is contaminated can unfortunately have low levels of PFAS, right? But it's hard to know if you go into a store if that does or does not have PFAS in it, right? So it's challenging. At home, the best things to do are try to avoid purchasing or using products that say stain repellent on them, right? When it comes to your furniture and your carpets, even paints, right? We may not think about, but paints, there are some brands that sell this scuff-resistant paint. Those have PFAS in them. And there are studies that show that they don't just stay in the paint, that they can off-gas and enter into the air and can lead to exposure. Now, how much that contributes to your overall exposure, I think we still have some uncertainties in that, but there can be multiple sources, unfortunately.
Is there a way to test the air the same as you test blood?
Yes, and we do actually have some studies ongoing where we're actually going into people's homes in certain areas and putting air samplers in there. We collect dust samples, we collect the drinking water, and we collect blood from the individuals living in there. And so we're trying to understand the relative pathways. So there are several of those studies ongoing across the country right now, and the hope is that we can synthesize that information to try to understand the relative importance of each of those.
Thank you. And I'll turn to Mr. Holt now. So you work on PFAS and public health for DHHS, and DHHS hosts the PFAS testing network, and you're continually receiving information about PFAS levels in waters across the state. You're also working on educating North Carolinians about the different ways they may be exposed to PFAS and how it can be affecting their health. How much more do the people of North Carolina have to learn about what PFAS is and where it is and how it's affecting our health? What's your sense of how much people know and how far we have to go in making sure people understand all this stuff?
Yeah, so I'll start with the where part first. I think where we're still learning a lot, and as Detlef pointed out, the EPA establishing those MCLs for PFAS is really do a lot to help us, because now utilities are to be monitoring and testing for these PFAS in their water supplies, and it can help identify where there may be PFAS contamination elsewhere. And so that's to be one thing, is to help us identify areas that may be impacted by these chemicals. And as you bring up Pittsburgh and the Hall River, that was something that, because of the PFAS levels in Pittsburgh's water supply, I was able to backtrack that, and some of the work that Heather and Detlef have done, backtrack that and kind of find those sources and figure out where this is coming from and help eliminate those sources before they get into our environment. They get into how much we have more to learn about PFAS and how it impacts our health. It really is to depend on what chemicals we're talking about. As Detlef alluded to earlier, chemicals such as PFOA and PFOS, we do have a relatively good understanding of the health impacts that they can impose upon us once we're exposed to them. However, some of the other PFAS that are, as was mentioned earlier, there's thousands of PFAS that are not being measured, we're not studying for, and some of the short-chain PFAS that we are seeing, we don't have a lot of information on, because we're just now discovering them within our environment and measuring them. And so there hasn't been as much research done on those chemicals to understand exactly how they're impacting our health. But as we stated earlier, with the framework that EPA established, where we're looking at doing this cumulative toxicity and looking at PFAS and how mixtures can cumulatively have additive effects and impact us, it allows us to, as we find out more about these PFAS, to more readily adapt and incorporate that toxicological information into our risk assessments and help us develop public health guidance for these PFAS.
Thank you very much. Does anybody have questions about that?
I guess this is just a follow-up to kind of like how much the people of the state need to still learn. What I've heard when I talk about PFAS is, oh, that's only a problem in Wilmington. And so I'm curious about, as someone who works for DHHS, are you hearing interest across the state, and what is sparking the interest? Because not every, right, some people in this room probably were like eagerly awaiting the MCLs, like when are they going to drop? But for a lot of North Carolinians, that's probably not true. So I guess, are you hearing about interest elsewhere, and when you are, what's kind of sparking that interest? Like, I want to learn more, I want to get my blood tested.
Yeah, so I will say PFAS is not just Southeast North Carolina issue, it's a whole state issue, and it's a worldwide issue, honestly. PFAS unfortunately have really contaminated a lot of our environment. And so across North Carolina, there is interest in other regions of the state. I mean, as we're here talking, this is OWASA here, so we're in Chapel Hill. OWASA is hosting this to talk about PFAS. There's other areas across the state, the Triad area, going up into the mountains, and a lot of other areas in the state. And what's really triggering a lot of this interest is people are now starting to find out that PFAS are in their environment, they're in their drinking water supplies, or that their occupation uses PFAS and they're being exposed occupationally. One common example is firefighters. So we have been finding fire stations across the state that do have PFAS because they've used firefighting foams in the past that had PFAS in them, and so they are finding out now, because we are looking and have better analytical methods to detect these PFAS, that they are in their environment, and that is really what's triggering a lot of interest across the state and elsewhere.
Thank you. Yes, sir.
Yes, my question is has to do with PFAS in the air. There's talk about changing the UNC cogeneration plant from coal to waste from a company in Wisconsin, waste from a city that's processed into pellets or something and burned here. And I know that, for instance, Milwaukee for decades sold millorganite, which was waste and was spread on farm fields and whatnot as fertilizer, and it turned out that there were some heavy metals in there, and you folks have been talking about all the places that the PFAS have been applied to. So it seems as though in burning urban waste, we're running a risk on that ending up in the air. And I'm wondering if there are tests that can be applied to the effluent, the smoke, and are they applicable to the most dangerous kinds or most significant kinds of these, if there are thousands of them?
I'm not personally familiar with UNC's proposed project. Is anybody here familiar with
They're substituting coal and they're talking about substituting coal and natural gas at the cogen plant for other types of waste, and wood waste is one of the options, or pellets.
But to answer the question about stack testing, so EPA is developing and has developed standard methods for PFAS, especially to look at stack testing. So there is an existing method to actually look for the same compounds that we worry about in drinking water. That method already exists. And then there are additional methods. One is in a draft form and one is still being developed to really cover a broader space of fluorinated organic compound emissions from facilities that burn PFAS containing wastes. Because one of the ways to destroy PFAS is incineration, right? So there's a big interest in understanding, are there emissions from those facilities?
Thank you.
Well, I have a question about that, because I thought I read that Maine outlawed sludge application, land application of sludge, and moved it all to incineration. And now they're stuck, and I don't know if it's just quantity or if it's actually creating more air pollution.
I would say the primary pathway right now is landfilling of those biosolids, and one of the issues I've heard is there's not enough landfill space, so they're actually trucking some of it out of state to different landfills, so that has created some challenges.
Okay,
yeah.
thank you.
And I'll stick with you for the next question, Dr. Knappe. Your team at NC State studies different ways that PFAS gets into the environment and into our lives. Is that kind of a good oversimplification of what you do? I saw lots of different things on your research page, everything from how plants absorb PFAS to how lithium-ion batteries put PFAS into the environment. What has your research taught you about how PFAS ends up affecting humans?
Well, so PFAS have a lot of fascinating properties, and because of that, they're incorporated into a lot of products, right? And if you hear something that's too good to be true, then probably there's an angle to that may not be so great. But it has made our lives easier, right? Non-stick pans, you get pizza boxes that don't get soggy, you get muffin cups that don't get soggy, you eat maybe off of paper plates. A lot of cosmetics have PFAS in them, dental floss, contact lenses, you know, the list goes on. A lot of outdoor gear, water repellency, right? And then also a lot of high-tech type of performance textiles, firefighter gear, military uniforms, where we're interested in not just water repellency, but also oil repellency. So some of these are extremely useful, right? And so that's why they're incorporated in so many different products. Unfortunately, for most products, there's no labeling, right? So when you go to the store, you don't really know whether something has PFAS in it or not. So you might buy cosmetics, put it on your skin, right? And you have no idea whether it has PFAS in it or not. So we're we're directly exposed in a number of ways. Sometimes the PFAS may transfer from a food contact material to the food, and so it's maybe somewhat more indirect. And then also, I always like to point out that, you know, the production of these products is a dirty business, and also the end-of-life management of these products. So the production facilities have contaminated vast stretches of land, water, and air around the country. PFAS manufacturing sites are really zones where people are exposed to very high levels of PFAS. And even though, you know, the fluorochemical industry tells you your Teflon pan is fine, and in parts I could agree, but making the Teflon pan, if you talk to the people that live next to these factories, they probably would disagree that the Teflon pans are safe. So, you know, emissions from facilities that either make PFAS or incorporate PFAS into products, like textile facilities in Burlington, emit waste streams that lead to environmental contamination and subsequently human exposure. So, you know, that has not only led to contaminated drinking water, but also to contaminated air, contaminated food, and like Heather was saying earlier, we're still trying to understand really the importance of all of these different exposure pathways, right? If we put cosmetics on the skin, how much gets through the skin? If we're eating food that is impacted by PFAS, you know, how important is that relative to drinking the water? The dust in your home, right? And so on and so on. So maybe I want to just also bring it home to Chapel Hill, Carrboro. So, you know, there are a number of facilities in Burlington, including facilities that make high performance textiles that use PFAS, and you know, the wastewater from those facilities gets basically dumped into the municipal sewer, and then that goes to the wastewater treatment plant, and then part of the PFAS in that wastewater get incorporated into the sludge that's produced by the wastewater plant, right? So the sludge is a waste product of wastewater treatment. Sometimes it's called biosolids, and a way to get rid of biosolids is to apply them to land. That's very common practice for many utilities around the state, including the Burlington facility. Well, so these biosolids were applied over vast areas of land in Alamance County, Orange County, Chatham County, and part of the fields to which these solids were land applied were near Cane Creek Reservoir. So that's one of the two drinking water sources for OWASA. And you know, we've measured the PFAS levels in the creeks that drain those fields, and they have over 1,000 nanograms per liter PFOA and PFOS in them. And so that's again a consequence on the waste management side, right? So a company is making high performance textiles. You can argue whether wearing those textiles is safe or not, but one of the direct consequences of making those textiles was contamination of the drinking water source, and OWASA now has to deal with that contamination.
Yes, ma'am.
At the first OWASA listening session, one of the speakers that I think was a spokesperson for OWASA said that because of some of that monitoring, OWASA had stopped land applying around King Creek in like, I can't remember, but it was something like 2019 or something like that. And they said they've been monitoring it since, and there has been no appreciable decline in the PFAS. And is that because, even though they stopped the source, is that because of the half-life of PFOA and PFOS, or?
Yeah, so you're correct that the land application at these fields has stopped. It wasn't OWASA that was planned applying, but it's really waste from Burlington. But the nature of the PFAS that are in those biosolids is such that they break down very slowly and probably for many decades to come. So I think that immediate effect of stopping the land application will only be useful in the very long term, but I think the problem will probably stay for a while.
Thank you. Any other questions? Yes, ma'am.
So at the beginning, you were talking about just how prevalent PFAS is in everything. Is the EPA or any companies doing anything to limit the usage of creating these products at all?
So there have been efforts primarily at the state levels that have succeeded to phase out the use of PFAS in certain applications. For example, the state of Washington has outlawed the use of PFAS in food contact materials. That's just one example. So there's been a big push to stop using fluorinated foams for firefighting. So in fact, yesterday was, I think, the day that the military officially phased out the use of fluorine-containing foams, with a couple exceptions. So there are these kinds of efforts that are policy-driven, but currently they haven't succeeded at the federal level. I think the other efforts are more consumer-driven, and therefore certain businesses and industries are listening to that. So the carpet industry, for example, in the US has made a big push to phase out PFAS uses in making carpets. Certain companies that make outdoor gear or certain larger stores are digging very deep into their supply chain to phase out the use of PFAS in all of their products. So there is a sort of a bottom-up push also where people are demanding this, and then companies or stores can market that. And there's a nice website, PFAS Central, and if you go to PFAS Central, there's a menu item called PFAS Free, and so you can look at a number of types of product categories, and then companies that have phased out the use of PFAS in their product lines. You know, let's say hiking boots, right? When I bought my last pair of hiking boots, I went to the website and I picked something that was PFAS free. Yeah.
Are you all aware of what chemicals they're using in the place of PFAS? Like, are those known at this time?
So, yeah.
So I was just gonna actually follow up to that. The thing to realize though is that not all companies even know if they have PFAS in their products. And that's a really big problem. So I actually have lots of discussions with the furniture industry here in North Carolina, and many of them want to know if PFAS are in their supply chains, but they don't know because they buy a textile for their performance, right? That's what's advertised. This is water repellent. But that doesn't mean it's PFAS treated, because there are silicone or wax treatments that you can use for that water repellency, not just fluorinated. So even companies have a hard time knowing if it's in their product unless you get it tested. And actually EPA has issued a rule requiring everyone either manufacturing PFAS or selling a product that likely contains PFAS to report this. The reporting rule is supposed to start next month, but it has been pushed back a couple months, probably because the infrastructure isn't in place to support that reporting rule. But there's a lot of managed companies here in North Carolina trying to understand how to address this new reporting rule, but it's going to be really challenging because it's really hard to backtrack through the entire supply chain for all these products. Yeah. Sorry, I didn't mean to cut you off. I just wanted to point that out, that there are companies trying to deal with this and having a really hard time right now. But yes, silicone and wax are, at least in textiles, are the biggest replacements.
Yeah, but that's an important question, right? Is the replacement any better? So in the case of my hiking boots, it's a polypropylene liner, which I think is definitely a big improvement. But there are questions, for example, with fluorine-free firefighting foams, whether their co-toxicity is really any better than chlorine-containing foams. So it's the question that everybody needs to ask before we just jump to the next problem.
I'm going to try to hurry us through a couple questions because we're almost out of time. This is for Dr. Stapleton and Kennedy. I know you've both been part of developing educational materials about PFAS. What are the most important things people should know about minimizing PFAS impacts on their health right now? And also for Dr. Stapleton, how have health impact studies been able to help us determine how PFAS, how people are being exposed to PFAS?
I'll start, I guess. So I think as far as minimizing your exposure, I think Detlef kind of stole a lot of thunder from this question, but really it's, it's understanding what products you're using and where everything's coming from with your PFAS exposure. As we've talked about tonight, drinking water can be a source, food can be a source, different products that you come into being a source. So understanding where PFAS is coming from in your individual life is really important, because then you can make decisions to how to reduce some of those things. So as Detlef pointed out, the website PFAS Central to identify products that if you want to try and cut some of those out. If you know you have PFAS in your drinking water, there's filters that you can buy to install at your home, or pitcher filters that can help further reduce PFAS from your drinking water. And food is a little bit more challenging, just because there's not great studies, and if you go to the grocery store, produce typically doesn't have a label on it. So food's a little bit more challenging, but there is research out there understanding, at least for produce, and I know Detlef's done some of this work looking at produce and how PFAS are uptaking into produce, and which produce may or may not have as much PFAS, and which could be potentially better choices when you're gardening and things like that. Some of that information's out there, but really understanding your personal PFAS exposure and where you can make changes to mitigate or reduce some of those exposure is really to be the key to helping reduce your individual PFAS exposure. Yes, for the health impacts and studies on that.
Sure. I mean, the most important thing for reducing your health risk is to stop your exposure, right? But it's understanding where that exposure comes from. That's the challenging part. So you have to keep in mind, if you know you're exposed and you know what your blood levels are, even if you stop your exposure, it's going to take years before your levels will drop in your blood, because these have very long half-lives, right? The top three, PFOA, PFAS, and PFHXS, have half-lives anywhere from 3 to 7 years. So that means even if you stop all exposure, it's going to take 3 to 7 years before your blood level drops 50% of the level at that time. So it takes a long time for them to drop. Right now we do have ongoing studies trying to understand how important inhalation is versus diet and drinking water in different studies across the country. We hope that'll provide some insights. Already we can see that for some PFAS, inhalation is important, and for others it does seem to be more diet or diet and drinking water, with a little bit of contribution from indoor dust based on the data we're seeing so far, and that could change as we collect more data. But then there's a question, well, where's it coming from until it end up in the air and the dust? And unless you test all the products in your home, it becomes really challenging. We do have, our group is actually supporting a study with firefighters in North Carolina right now, because we really want to help firefighters understand their exposure to PFAS, because they may be a uniquely vulnerable population because of the firefighting film, but also because their turnout gear has been treated with PFAS as well, and the durable water repellent finish and the outer layer of the gear. So we have a statewide project right now where firefighters can participate and have their blood analyzed for PFAS. We have a better understanding what that is, and trying to understand how much exposure does come from the foam versus how much may be coming from their gear. So we hope to have more answers to these questions in a couple of years, but unfortunately it's just going to take time.
Thank you. Does anybody have any questions about that? Grace?
Yeah, so there's some who say that the short-chain PFAS compounds are not as dangerous as the old long-chain compounds, because they don't stick around in the body as
whether it's cleared from the body versus whether it has a health effect, right? So I'm gonna use the example of Gen X versus PFOA. PFOA, when it gets in your body, it has a half-life of a couple of years. Gen X is excreted more quickly based on structure. However, based on studies done in rodent studies in mice and rats, when you give them similar exposures, there are similar impacts on the liver and some immune function endpoints, reproductive endpoints. So even though it's cleared from the body at similar exposure levels like in your drinking water, it is still having similar effects. Now that's Gen X versus PFOA. I think there's a lot more we need to know about some of the other chemicals as well, but I wouldn't say just because it's cleared from the body that it's not as toxic. It really depends on what your exposure is. Is it chronic every day or not in some cases? Because we have other chemicals we know that are bad for you that are excreted pretty quickly in a matter of hours, right? So it depends on the hazard, the toxicity of that compound and whether your exposure is consistent.
There's also a new study that came out from EPA about methoxyacetic acid, so it's a 3-carbon PFAS. And one of the things that really stood out to me was that the author said the uptake rate into the body was a lot higher for this compound. So when they dosed the mice with the same amount of PFOA and this ultra short chain PFAS, the blood levels in the mice were actually the same, whereas for Gen X they were lower. So there was a lot of things that we don't know, but it looks like the uptake into the blood is also perhaps enhanced for these ultra short chain.
Thank you. Any other questions? Yes, Sean.
So, if somebody's drinking water that's right at the promulgated MCLs for life, holding all things equal, compared to somebody else who has not been drinking, is drinking water that doesn't have any of the PFAS that's promulgated MCLs, what's the increased risk that person is having at right about the promulgated levels?
So I'll preface this not to be a nice answer to give here. So not to disparage the MCLs, there's a lot of work that went into that, and I do agree that it's the right step. The MCLs, when they are developed, part of their development, as Detlef talked, they talk about the maximum contaminant development goal. So what is the ideal exposure to this? And with, I'll just use PFOA in this example, is a likely carcinogen, it's 0. You don't want to be exposed to any of it. That is not the case until you establish a 4, which right now that is where our labs can detect to. And so that is where it's set up. Part of that decision making with MCLs, they have to do a technological or economic feasibility, and a lot of things go into this. It's not just a health-based number, otherwise it would be 0. If you look at the toxicity data from the EPA's toxicological risk assessment, when you're looking at these chemicals, you can see that they develop the cancer slope factor. And if you use just generic exposure factors to calculate drinking water standard using the cancer slope factor, the drinking water standard for PFOA versus purely based on health would be below that 4. It would be an order or two magnitude lower than what the current standard is. And so when we're looking at cancer risk, it's we typically look at a 1 in a million cancer risk on that. It is kind of more conservative end of that. And so if you're looking right around the drinking water standard, there is an increased risk there. Again, I'm just ballpark mathing off the top of my head, probably in the tens of thousands, hundreds of thousands, somewhere in that range. And there's an increased risk you would have there. So that's a quantitative measure just off the top of my head based on looking at the numbers. But typically 1 in a million is the most conservative. So when we're developing these standards, we're trying to develop, the EPA is what they determine as acceptable risk is between 1 in 10,000 and 1 in a million is what is acceptable in the general populace in terms of a risk number that you're shooting for. And so I know everybody's risk is different, and nobody wants to be exposed or have any increased risk, but just the way our system and our regulations have been set up, that's kind of what they're aiming for. So again, no, it's not a super nice or happy answer, but that's kind of where you look at all the different science and do all that. That's kind of where the
studies overall have been rather limited and
Good evening,
primarily focused on
the time is
PFOA.
now 7:30 p.m. and the library is closing in 30 minutes at 8 o'clock. Once again, it is now 7:30 and the library is closing in 30 minutes at 8. Thank you.
So recognize that most of those health studies have been largely focused on PFOA and PFOS. Now that EPA has promulgated the MCL on just a very few number of PFAS, to what degree do you think research dollars will be further concentrated on those limited PFAS, or do you think there will be more efforts to study health effects of the larger family of PFAS?
I have a little bit of the answer for this one. So I'll say again, I'll borrow Detlef's words from earlier, it's hard to look into crystal ball.
Right.
But one of the things that I've been seeing as we've kind of started addressing some PFOA, PFOS, when we start looking at other PFAS, it started becoming more regional in what I'm seeing. So PFAS that we're seeing in North Carolina, and I'm gonna go to the Cape Fear region here where we're seeing Gen X, PFMOAA, Pantheon byproduct 2. These are, I know these don't mean much, but these are PFAS that we're seeing down in North Carolina. Other regions of the country are not seeing those same PFAS. So what may be important to us here in North Carolina is not necessarily what is important in, let's say, Michigan or California or elsewhere. And in some of the discussions I've had with other people, it seems like going forward, a lot of it's be driven probably more regionally. So like our universities and our research partners, like thankfully here in North Carolina, we have NC State, UNC, ECU, all these research universities that have professors that are dedicated and looking into all these different PFAS specifically for our state. I think it's to be something that is probably not as big of a national effort in terms of something like PFOA or PFAS, but I think it's to be more regional when we're looking at our profile, our PFAS profile here in North Carolina, and what can we learn from it from our researchers, because other areas will be tackling their own PFAS issues because they have their own signatures and profiles. And again, that's just my perspective. Obviously, I don't know if y'all have different perspectives.
There's certainly more ongoing studies that are focusing on mixtures, because we all recognize that we're not exposed to just PFOA or just PFAS. So lots of researchers are looking at mixtures of PFAS to try to understand, do we assume that each of these add up to understand our risk, or there's synergism? Like, there's a lot of ongoing research studies, so I'm hopeful in the future we'll have more insight into that. But from my perspective, one of the other overarching issues on top of this, not to make it more complex, is that as some PFAS are phased out from use, right, we move to things like short chain PFAS. Now we're seeing a lot of short chain PFAS, and we don't know what that means and if they're toxic or not. And then you have these other bigger PFAS that can break down into the problematic PFAS, right? So it's just a very complex model out there, and we're really just trying to piece away at it, but it just takes time and more funding. Yeah, I mean, we have the short chain PFAS issue, we have the precursor issue, so there's a lot more to do.
Okay, last question, Terry.
Well, I have two questions. One is kind of easy. At the Pittsburgh meeting, you told people not to use whole house filtration.
That was fine. Yes.
So I was wondering if you could explain why. And then my second question is, you said that the current standards have been challenged. And politically, can you tell us who is challenging?
Yeah. So, all right, so whole house filters. First of all, they're very expensive. Second of all, in the study that Heather and I did on home filters in general, the whole house filters were the most poorly performing of all the different filters we tested. But third of all, I'm especially concerned about those filters taking out the disinfectant residual at the point of entry to the home, which means that the pipes inside of the homes are not protected by the disinfectant, and that could lead to the growth of certain pathogens, and then we're just trading a chemical problem with the biological problem that could be potentially immediately lethal, like Legionella really discourage people who, especially are people who are served by public water that's derived from surface water sources, right? Because that's where most likely you would get bacterial growth, right? So I always have to distinguish that from people who are on a private well. A private well isn't really disinfected, right? So there are certain types of filters that are especially designed for PFAS removal, that are whole house filters, that are very good for private well users. So it's important to distinguish between these types of treatment systems and scenarios. The PFAS standard has been challenged by two entities, the Florida Chemical Industry and the American Chemical Council, but surprisingly also by the American Water Works Association, which is the lobbying group of the drinking water industry, because of the perception that it's too expensive. So I'm not so happy about that part. And they have some, there are some reasonable arguments, let's put it this way. So part of the challenge is to raise the standard from 4 to 10 for PFAS. And that would take about 90% of the drinking water systems that need to treat for PFAS. The good part about that would be that the focus would be on the more heavily contaminated systems, and all the efforts and energy would go there. And I'm concerned that maybe some of the energy goes to a system that has 6 nanograms per liter, right? And it's a large system, and maybe a lot of resources go into that system, and then some other systems have more trouble having access to the resources. You know, like, are we making enough activated carbon for all of these utilities in the country? Do we have enough reactivation facilities for all of these systems, right? So there is, as bad as it sounds, some argument that you can make that raising the standard, at least for the interim, could be more beneficial from a systems perspective overall. But I would, in my opinion, I would say phase it in over time, right? Maybe first focus on the more heavily contaminated system. In the meantime, maybe the infrastructure will be built to make more activated carbon, to have more reactivation facilities, so that the other systems that are not as heavily contaminated can also get their treatment. So it's complicated, right? It's not just black and white.
Thank you so much. I want to respect everyone's time, so would everyone please join me in thanking our wonderful panelists.